Welcome to our next video. We'll be looking at hypothyroidism. I hope we understood all that we've been talking about in hyperthyroidism, though we are going to have a visual class on Teams to have a discussion after you've watched all these videos. So I hope to meet us in the visual class when we are done watching all these videos so that we can actually have our questions. In the visual class, we'll actually discuss so that I know the areas that you have questions. So now we'll be looking at hypothyroidism. Hypothyroidism is actually a chronic disease associated with a deficiency in thyroid hormones, such that your thyroid hormones are actually reduced, and this can actually be caused by one, insufficient iodine, or destruction of the follicular cells. So destruction of the follicular cells or insufficient supply of iodine, deficiency of iodine now is actually a common cause. Deficiency is a more common cause compared to destruction of follicular cells. So the most common causes of primary hypothyroidism is actually your Hashimoto's disease, which we looked at that it could actually stem from hyperthyroidism, like we saw in transient hyperthyroidism. It could actually stem from the follicular cells being destroyed, and then we gradually then have low supply of thyroid hormones. So Hashimoto's disease is actually caused by autoimmune deficiency. When there's an autoimmune destruction of your cells, of your follicular cells. This autoimmune destruction of your follicular cells can actually be as a result of an attack on the anti-thyroid peroxidase enzymes. When there is an attack in the anti-thyroid peroxidase enzymes, which alters a particular mutation is being altered in your genetic pathway that codes for these anti-thyroid peroxidase enzymes. Once it's altered, then we'll have that the follicle will be destroyed. The follicular cells will be destroyed. Thyroglobulin, which is a skeleton that helps with the formation of thyroid hormones, cannot actually be properly formed because of this attack in the immune system. And so we'll be looking at the first cause of hypothyroidism, I said, is iodine deficiency. The second one is autoimmune destruction, as seen in your Hashimoto's disease. We have something called radial thyroiditis. Radial thyroiditis is actually when there is a dense fibrosis. A dense fibrosis actually replaces your thyroid parenchymal cells. And this is as a result of immunoglobulin A antibodies. Immunoglobulin A antibodies actually causes destruction of your follicular cells by activating a fibroblast. So there is this dense fibrosis that occupies the thyroid follicles. Instead of having thyroid follicles, you then have a dense fibrosis occupying that area due to overactivation of your fibroblasts. This can actually be as a result of your alteration in immunoglobulin functions. The next cause of hypothyroidism can actually be an upper respiratory viral infection. This is actually transient. It's actually a transient hypothyroidism whereby there is a viral infection in your upper respiratory tract, causing a painful and swollen thyroid. It actually resolves once this viral infection is being taken care of. The next cause of your hypothyroidism is surgical removal of your thyroid gland, which is called thyroidectomy. So in thyroidectomy, you have low levels of thyroid gland. The last one where we have is called Wolff-Chaikoff effect. Lufchenkov effect is actually a thyroid autoregulatory mechanism where a sudden large intake of iodine actually inhibits the synthesis of thyroid hormones. It is a sudden large intake of your iodine which actually inhibits synthesis of T3 and T4. This affects the enzyme thyroid peroxidase. If you remember the function of thyroid peroxidase, so thyroid peroxidase is actually the enzyme that is altered here. A temporary alteration. The thyroid can actually pick up its function again when this alteration is taken care of. But remember that a sudden intake of your thyroid of iodine can actually disrupt the function of thyroid peroxidase. It affects that function, and so there is reduced production of your thyroid hormones. So these are the diagnostic indicators of thyroid abnormalities, such that if you have a primary hyperthyroidism, in primary hyperthyroidism, you have that your T3 and T4 will be increased, your TSH will be increased, but your TRH will be decreased. In your secondary hyperthyroidism, you have that all will be increased. Your TSH, your TSH, your TRH, your T3 and your T4 will all be increased. Then in your primary hypothyroidism, you have the reverse of what takes place in your primary hyper. Your primary hypothyroidism, you now have your T3, T4 is decreased, TSH is decreased, but your TRH will be increased. Then in your secondary hypothyroidism, you have the same thing that happens in your secondary hyperthyroidism. Secondary hypothyroidism, the TSH, the TRH, the T3, the T4 all be increased. This is all we have for introduction of thyroid hormones. We've looked at the introduction of thyroid synthesis, we looked at the thyroid gland, we've looked at the pathophysiology, the hyperthyroidism, the hypothyroidism. In our next video, we'll be looking at parathyroid hormones and its dysfunction. Thank you.